Chairman, we're ready to begin.
Thank you, Denisha, and good morning to everyone. Denisha, would you please call the roll of board members?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Roger Folsom,
Here.
Cynthia Rucker,
Here.
Tommy Hopkins,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
David Cruz,
Here.
Shane Mobley, Robert Coles, Chairman, that concludes my roll call.
Thank you, Denisha, and I believe that means the response is that we do have a quorum to conduct business, so I will call the meeting to order and welcome all of you, and thank you for taking the time as board members to participate this morning. We do have a rather short agenda today. We'll have two items that we're going to be asked to consider for initial adoption. But to move into the agenda, first of all, I will call on Dr. Cynthia Rucker, our secretary, for the review of the minutes of the previous meeting, March 14, and ask if she would recommend that those be approved as written.
Good morning, Chairman and everyone. I have reviewed the minutes from the March meeting. I found them to be in order and I recommend they be approved.
Dr. Rucker has made the motion that the minutes be approved. Is there a second?
Second, Tommy Hopkins.
It has been seconded. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, they are approved. Thank you very much, Dr. Rucker. Next on the agenda, I will call on Anthony Williamson to give us a report of his Care Management Committee meeting that took place this morning.
Thank you.
Anthony, would you please proceed?
Yes, thank you, Chairman Boyd. We did have another good meeting this morning of the Care Management Committee. We started with welcoming Stuart Portman, our new Executive Director of Medical Assistance Plans. He is going to be kind of accepting the baton, if you will, from Lynette Rhodes, who has kind of provided oversight for the Care Management Committee in the past. So going forward, Stuart Portman will be leading those efforts. And then we had two presentations this morning. The first was from Dr. Kelvin Holloway, our Senior Medical Director of our Medical Assistance Plans. He presented on the 2024-2026 quality strategy update for our Medicaid and CMO programs. We got to hear a lot about the contents of the quality strategy and the goals, and kind of as it's evolving and developing. We will be focusing on a number of areas, including access to care, wellness and prevention, focus on outcomes for chronic diseases, maternal and newborn care, behavioral health. We'll be looking at our utilization of care and the overall member experience. Some kind of heightened areas of focus this year will be the focus on behavioral health and maternal newborn outcomes, and access is also a focus. We then transitioned to our second presentation from Maxine Elliott, our Deputy Executive Director of Medical Assistance Plans, and this presentation was on mental health parity. Very interesting presentation, looking at the prevalence of mental health issues in Georgia and the efforts to align the levels of mental health care with those available for physical health care in the state. A lot of the presentation focused on the implementation of House Bill 1013, which was passed in 2022. This is a 5-year implementation plan with a very comprehensive approach to improve mental health care in the state. Again, looking at things such as access to care, increasing the number of mental health crisis centers, trying to increase the number of professionals working in the field, focusing on data related to parity from our health plans, and that's mostly around coverage. Is the coverage that's offered for mental health similar to that for physical health? Increasing mental health screenings, a big focus on catching autism early, especially within our pediatric population. So we heard about those efforts. And there is, of course, a website for mental health parity underneath our DCH website that has comprehensive information on the effort, as well as the data or the compliance reports from our CMOs on their efforts with mental health are posted there for all to see. And so that information is available, as well as a mental health parity complaint portal, making it easy for folks to provide suggestions if they feel warranted. And that was the end of our second presentation, and there was no new business, and we adjourned. So a really, really good meeting this morning. We did thank Lynette, and I should call that out, thank Lynette Rhodes for all of her efforts with the Care Management Committee in the past. So really enjoyed working with her.
Thank you, Anthony, for that report. Are there any questions, comments for Anthony from the board, please? Hearing none, thank you very much. And we'll move into the next item on the agenda, which is the commissioner's report. And this morning that will be given by Joe Hood, our Chief Operating Officer.
Thank you, Mr. Chairman. The commissioner sends his regards, and he has some planning efforts at the end of session, sometime with his family. So I'm here today for this short agenda. I did want to, as part of the remarks, prepare the board that, while we have a couple of items, as the chairman referenced, this board meeting that we're moving forward on, next board meeting, we do anticipate quite a workload of items to come forward. And just as a reminder, that's because we have the end of session and we have the end of our fiscal year, and we're trying to put forward all the items that would be necessary to start our July 1 fiscal year. And many of those require notices or initial and final adoption periods, as y'all are well aware. So just be aware that next time we really hope for your participation, and be prepared for a really full meeting, I expect, even though we have a short one today. So appreciate the time. Other than that, we had a successful session. As y'all are aware, the session has ended, and that was at the end of March. And we're moving forward on all the different initiatives and researching those and looking at those as the governor contemplates the signing of bills and the signing of the budget, which will not occur until probably early May. With that in mind, the other item that I wanted to accomplish today was to recognize our employees, as the commissioner normally does, for the milestones. And we wanted to start out with the 1-year employees, as he has typically done, and recognize them for completing 1 year of service. We're very happy to have them with us and to have noticed that they've completed that first year, and hope that they continue on with us in good stead. The first one is Valerie Henry with the Healthcare Facility Regulation Division for 1 year. The next one is Kim Stockton in X-ray at the Healthcare Facility Regulation Division for 1 year. And those are the only 2 1-years we have this time. Celebrating 5 years of anniversary with the department is Tanika Braithwaite with the Division of Financial Management. Eric Durham with GDNA, Georgia Drugs and Narcotics, our attached agency. Then moving to 10 years, Kathy Chatham with the Healthcare Facility Regulation Division has 10 years of service. Marquetta Martin has 10 years of service with the Office of Information Technology. Tamara Finley with our Office of Inspector General Office has 20 years of service. Michael Carnback with GDNA, Georgia Drugs and Narcotics, has 20 years of service. And then moving to our 25 years, we have Waverly Wesson, who's in our Office of Information Technology, who has 25 years of service. And Antoinette McFadden in our Healthcare Facility Regulation Division has 25 years of service. That's quite a career there. We really celebrate those years of service and appreciate their continued service to the state. With that, Mr. Chair, that's all we have for the Commissioner's report today. And as I say, I know he'll be back next month for our full agenda, and we look forward to that.
Thank you, Joe. Are there any questions or comments for Joe, please? Hearing none, we'll move into the first item on our agenda that will require consideration for an initial adoption of vote. And we'll call on Kim Morris, Financial Management Director, to make that presentation related to nursing home patient-driven payment model. Please, Kim.
Good morning, Chairman Board, members of the board, Chief Operating Officer Hood. Today I'm presenting for initial adoption pending Medicare and Medicaid services acceptance, a proposal to replace the current Resource Utilization Group RUGS-based resident classification system with the patient-driven payment model classification system effective July 1, 2024. Total funds to implement this change is $71,264,248 with state funds of $24,308,235. On October 1st, 2019, the Centers for Medicare and Medicaid Services replaced its Resource Utilization Group-based resident classification system with the patient-driven payment model-based classification system. Due to the change, CMS has indicated to states that it will remove elements from the minimum data set resident assessments that are necessary for resident classification system under the new PDPM system. States could require nursing homes to complete an optional state assessment, which would be valid through September 2025 and then transition to PDPM. Georgia has decided to go directly to PDPM and eliminate the need for nursing homes to implement a temporary solution that would be more of an administrative burden. PDPM has 5 acuity components: nursing, physical therapy, occupational therapy, speech language pathology, and non-therapy ancillary. The department has decided to use only the nursing component. The other 4 components weren't used since they are reimbursed outside of the Medicaid nursing home per diem, and their primary payer source is Medicare Part B or fee schedule. The department, along with Myers and Staffers, provided educational sessions at the June 2023 Georgia Healthcare Association Summer Convention and a DCH-sponsored webinar in November 2023. Providers can also access educational material on the DCH website. The department also provides providers with a quarterly shadow rate using the PDPM-based classification system to compare to their current RUGS rates. An opportunity for public comments will be held on April 17, 2024 at 11:30 a.m. And individuals wishing to comment in writing must do so on or before April 24, 2024. At this time, I will pause to see if there are any questions.
Any questions, comments from the board for Kim, please? Kim, as I understand this, just to draw a bottom line here, these are changes that really are required, that we make changes because of the changes in regulations, and we have taken the flexibility where we could in those things to lessen some provider paperwork, so to speak, or detail. Is that correct, to lessen the administrative burden?
That is correct, Chairman Boyd, I'm sorry.
Any other questions, comments? Hearing none, is there a motion for approval for initial adoption?
Shane Mobley motions for approval.
Shane Mobley has made the motion for approval. Is there a second?
Hopkins second.
There is a second for the, for approval. Is all in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Kim, thank you very much.
Thank you.
Next item on the agenda to consider for initial adoption, Brian Dowd will make the presentation on medical assistance plans.
Thank you, Mr. Chairman. I am presenting today for initial adoption, a rate increase for the Georgia Pediatric Program, or GAP. GAP provides in-home skilled nursing, behavioral supports, and personal care supports to very medically fragile children. The proposed rate increase is for registered nurse in-home skilled nursing, licensed practical nurse in-home skilled nursing, and personal care support. The codes and increases by codes are listed in the public notice. The rates are consistent with the recent rate studies DCH completed for the home and community-based waivers. The increase in rates of reimbursement is funded in accordance with the 2024 Georgia legislative budget and is contingent upon the governor's approval of this item in the budget. The proposed rate increase is estimated to increase expenditures for DCH in the amount of $46,973,573 in total funds, of which $15,957,601 is state tax dollars. An opportunity for public comment will be held April 18th, 2024 at 11:30 a.m. via Zoom audio. Written comments are due on or before April 25th, 2024. I'll pause now for any questions and will respectfully request initial adoption for the proposed rate increases in the Georgia Pediatric Program.
Thank you, Brian. Are there questions or comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Dr. Lee approves.
Approval.
There's a motion for approval. Is there a second?
Dr. Cole, second.
Dr. Combs has seconded that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved, Brian. Thank you very much.
Thank you, sir.
With that, both of those items will be initial adoption, and after the public hearings and any modifications we make, will, I'm sure, come back for our final approval at probably the next meeting. With that, is there anyone who knows of any new business or things that should come before the board at this time? Hearing none, I will again make the comment as our Joe has made for your planning purposes for board members and your busy schedules. Please plan a little bit of extra time for the next meeting and preparation for that meeting because of the number of items. I believe we may have as high as 15 items to consider for vote next time. That would be an all-time record, I believe, for one meeting if that turns out to be the case. With that, if there's no other comments or any business to come before the board, we will be adjourned, and thank you all very much for your participation this morning.
Thank you,
Thank
Mr.
you.
Chairman.
Thank you.